Another Facebook time.
Recording in progress.
All right, so let's go ahead and get started. Hi everybody, I'm Kenneth Cruz. I'm a community health worker with the HRSA team here, African Services Committee.
And hello everyone, I'm Miriam Traore. I'm the outreach specialist for the Test and Trace program here at African Services Committee.
And we're just going to be presenting our COVID-19 Empower Hour, which is part of our monthly series that we're starting, talking about how to stop the spread of COVID-19 and stop the spread, more importantly, of COVID-19 misinformation in our communities. This monthly series is going to have 3 parts, usually done in the same week, with the English version being on one day, the French version being on another day, and the Spanish version being on another day. It'll take place from 12 to 1 p.m. Eastern Standard Time, and it'll also be recorded and broadcasted to Facebook. So if you can't catch it when it's being broadcasted, you can always find a recording on Facebook, and I think also our website. Again, follow us on our social media accounts, just make sure that you're following along. Facebook, Instagram, LinkedIn, Twitter. And yeah, so that's what we'll be doing. So first, to introduce who we are, we're part of African Services Committee. And African Services Committee is a multi-service human rights agency in Harlem, dedicated to assisting immigrants, refugees, and asylees from across the African diaspora. So that's, of course, what it was founded upon, those ideals and that vision. But again, we're very dedicated to the local communities. So if you are, say, identifying as Latino or Hispanic, you could, of course, come in and we'll help you out too. And the services that we offer to help you are confidential health, housing, legal, social welfare, education, nutrition, and advocacy services. And all of this is regardless of your immigration status or ability to pay. So if you're in need of any of these services, just feel free to walk into our offices, and the front desk will reach you and ask you how we can assist you. And this is just the agenda for today's COVID-19 Empower Hour. So we're going to be following this very closely. And we broke it down to 4 major parts. So the first part being explaining what testing resources we offer. The second part being explaining what vaccination resources we offer. That includes talking about what a vaccine is, how it affects you, what effects it may have on you, how does the COVID-19 vaccine work, how that differs from a traditional vaccine, what effects that may have on you. We'll also get into who can get a vaccine, so who's eligible, who's maybe wanting to get their first dose, and seeing if that's possible, or who's eligible for a booster dose, or what happens if you're immunocompromised. And of course, we'll go into what about my immigration status. So for folks who often in the community talk about if they can get vaccinated being undocumented, oftentimes there's a fear of maybe being found out or declared to the city or to the federal government. We'll talk about that topic a little bit more. And then we'll also get into myths. So some COVID-19 vaccine myths. What are they? How we know they're false? What have we learned from vaccine science that we can immediately use to dispel some of these myths? And lastly, what can we do to inform our community? So what steps can we realistically take to make sure that this information reaches not just you, but you yourself pass it on to your friends. So
Yeah, and for that, just if you have any questions and general questions about like what we'll be covering in our agenda, or just general questions about the COVID vaccine or testing, feel free to insert that in the Q&A box. Whether it's on Facebook, you can comment on the live, or here on Zoom. So yeah.
Yeah, and in English, French, and Spanish is just fine.
Yeah.
Also, if your question is more personal or private and you don't feel like broadcasting it, feel free to contact us at the numbers on the screen. So we have a line for the English and French, and then another line for Spanish as well. All right.
So we're going to first start off with testing, because COVID-19, the main thing that, started with knowing whether you have the virus or not is with testing. So first and foremost, African Services Committee definitely provides free COVID-19 PCR testing. And this can be, you can either make an appointment or you can walk in to the testing center. So the testing center is available Monday through Friday, 1 to 5. And 9 to 5. So but whatever time is convenient for you, feel free to walk in or call ahead to come in. And here specifically, I'll go into the details between the difference between PCR testing and rapid testing. But we also have rapid test home test kits available here at ASC. And feel free to contact us if you at the number provided, if you're interested in getting one of those home testing kits.
Yeah.
So what is the difference between PCR testing and rapid testing, but specifically rapid at-home testing, because that's what we provide here at African Services. So the PCR test really takes the sample of a nasal swab or a saliva swab. It depends on the testing site and which one they choose to do, but I think the most common is the nasal swab. And the results are usually available between 1 to 3 days. So again, depends on the company or where the testing center is. And the results are reliable for people with and without symptoms. And as well as no follow-up test is really required because it's pretty legit. So for rapid tests, and like I said, specifically for the at-home testing kits, the sample is usually a nasal swab, especially the one that we provide here at African Services. And the result is you can get the results within 15 to 30 minutes, 15 minutes really. And then it is less reliable for people without symptoms. So we really recommend people who have the symptoms or like are a little suspicious that they might be, they might have some of the COVID-19 symptoms to really use that. And we do recommend that you actually go to a site that does a PCR test to really confirm that whether you have COVID-19 or not. So
yeah, and just a little bit on that. So just to clarify, the PCR test that we provide is definitely going to be a nasal swab, right?
Yes, that is.
Yeah, and usually the result turnaround, I mean, that takes again 1 to 2 days, depending on if the labs are backed up or if there's a lot of people getting testing. For example, in the holiday season, you would maybe expect a week for your results to turn around. Yeah. And then the vaccination resources that we offer. So if clients are interested in getting vaccinated with us, we can certainly help them with that process. One way that we really help our clients is by making the vaccination appointment for them. So oftentimes that process of going online, finding a vaccine site, seeing if it works with your schedule, it can really be time consuming. So we try to take the work out of that completely for the client. So if you're interested in getting vaccinated, you can contact us. And basically what we do is we try to find an appointment near you that's as accessible as possible to get your first, second, or booster dose. And we'll use your zip code to find an appointment near you. We'll also ask you some follow-up questions to book the appointment, but essentially that's what we do. And we also offer some free COVID-19 vaccine events. So those are more from time to time. And again, we'll always let our clients know, especially the ones who have reached out to us saying that they're interested in getting vaccinated. We'll let them know that we're having a vaccine event that month. Those events are coordinated between us and other local community organizations. And usually they'll be held at our office, usually between 1 to 5. And at those events, typically we provide all the vaccines. So J&J or Johnson & Johnson, Moderna, and Pfizer. And we vaccinate kids and adults Of course, kids would get the Pfizer one because that's the one that's available for kids ages 5 and up. And all the vaccines are given free of charge, of course, and regardless of immigration status. Usually their appointments preferred, will walk in also acceptable. So we can lock down a spot for you, a time slot for you. And if you prefer to just walk in because it's more convenient, you can do so.
Yeah, and kind of booster shots are usually available as well.
Yeah, booster shots definitely available if it's been 6 months after your second dose. With the Johnson, that's a great question actually. So with the Johnson & Johnson, you'll typically wait 2 months after your first dose before getting a booster shot. And when you get a booster shot, you can mix and match. With Johnson & Johnson, I think we prefer it to be an mRNA vaccine that you're boosting with, but it's completely up to you. Yeah, and there's some more information on the screen about the vaccine event. So it'll be, we'll have a vaccine event this month, February 28th, from 1:30 to 4:30 p.m. It'll be at our office at 429 West 127th Street, and that'll be in collaboration with Ryan Health. Again, we'll be offering the Johnson & Johnson, Moderna, and the Pfizer vaccine for adults and children. So contact us at that number if you feel like scheduling an appointment with us to lock down a spot. Again, we also accept walk-ins. Okay, so a lot of questions that I hear from the community stem from kind of this lack of transparency about vaccine science. So really I wanted to get into what is a vaccine? How do they work? Because sometimes it can be confusing. So just a little bit about vaccines. Essentially, what happens when you get a vaccine and how they work is that we're introducing a small, harmless piece of either the virus itself. Some people call it a live virus vaccine, or we'll introduce a small piece of its genetic code, which is usually what the mRNA vaccines do, and the Johnson & Johnson does it through a different way, but basically the same thing. What this little piece does is that it teaches your immune system how to fight it. It gives it basically the training and the practice against this little piece of that virus, so that when the real virus comes about, they're not taken aback or off guard. They already had experience fighting it. So even though it's not exactly the same encounter, because the little piece is not the same thing as the entire virus, they're a little bit familiar with it. So that's what helps you fight off the virus when you first encounter it.
So for the other part about like what is a vaccine, vaccines are not new. Like with COVID-19, we see that the talk of vaccination or vaccine of the COVID vaccines has become, it seems like it resurfaced out of nowhere, but it has not. There are vaccines, there are many vaccines that most of us have probably taken that we just don't think about it on the usual. So like, for example, polio, measles, and mumps. Those are mainly vaccines that are required for children, I think, before entering, like just going to school in general. So to prevent them from either contaminating other kids or exposing other children to it, or even exposing adults to it, or being exposed to it themselves. So in terms of that, the COVID-19 vaccine is not something new. It's just a different virus, which is why, and a virus that we are not too familiar with or haven't looked much into before, but the vaccine talk is nothing.
And just to add on that, the reason why we don't see cases of polio, a little bit of measles, but that's because people are starting to not get vaccinated against it. The reason why we don't see cases of these viruses that much anymore is because everybody got vaccinated against them. These were vaccinations that at some point were mandated for children to get by a certain age if you want to enter school, or for adults if you want to enter the workplace. In most places of work and school, you had to have these vaccines, a record of having been vaccinated. So we don't hear much about them anymore because everybody has been vaccinated and nobody has gotten it because of that. It's hard to spread when everybody's vaccinated, and the percent of catching that virus is really low.
Right, because even when you're traveling, you want to double check like what vaccines I need to enter this
Exactly.
country
Yeah, for sure.
like
Yeah, some countries
so,
don't even have restrictions on it. So.
Right. So we deal with it on a daily basis. I just think with COVID-19 vaccine is just like, oh, okay, yeah.
Well, yeah, and that actually brings me to the next slide. So when we're talking about COVID-19 vaccines, people tend to think it's a new topic. It's not the same as the old vaccines that we're used to, because it uses new technology, the mRNA technology, which has been researched for the last at least 20 years. So it's new in the sense that it hasn't been implemented in a vaccine that's widely available to people, but it's been researched for a very long time up until this point. And so I'm just going to talk about the mRNA vaccines, how they work first, and then I'll get into how the viral vector vaccines like Johnson & Johnson work. So when we're talking about the mRNA vaccines like Moderna and Pfizer, we're talking about how we're building your body's immune system to fight against COVID-19. The way we do that is, or the way scientists are doing that, is by introducing this thing called mRNA. mRNA exists in your body in many forms. It's what's needed to create proteins in your body, of which we have a lot in different forms. And it's created from DNA. So basically, we take that mRNA, we put it in a vaccine, we protect it to make sure it's not destroyed by your cells, and that mRNA tells your body's cells to produce the protein that is that's encoded by the mRNA. So the mRNA is kind of like this little instruction manual. Your body reads it, builds the protein, and once your cells build that protein that come out as the little COVID-19 spike proteins, once they build that protein, the body recognizes it as something that's not normal, attacks it, and that's the first immune response. So that's your body's first response to the COVID-19 spike protein, which is good because now your body's starting to get familiar with the COVID-19 spike proteins, which all COVID-19, or when we first came out with the original COVID variant, all the COVID-19 viruses had that spike protein. And it's just kind of similar to when you're driving down a one-way, mRNA is needed to create proteins, but oftentimes I hear, well, what if mRNA changes my DNA? And it doesn't really work like that in your body. So when you have mRNA, it's to create proteins, and it comes from DNA, but it can go backwards. It's a one-way street in that regard, in that you drive down, but you can't really, it's illegal to go back up. So there is no way for your body to put it back into DNA and somehow affect your genetic code. That's not a worry at all. Actually, soon after you get the vaccine, the mRNA just degrades. It just breaks down, and you never see it again. With the viral vector vaccines, so that being the Johnson & Johnson, it works pretty similar. The only thing is that instead of just introducing the mRNA by itself, it introduces it into a unrelated, harmless virus. That's what we call a vector. So basically that harmless, unrelated virus just carries the mRNA into your body and then acts as a way of transporting the mRNA into your cells. From there, it's pretty much all the same. Your body reads the mRNA because it's a little instruction manual, builds a spike protein, it attacks the spike protein, and there's your first immune response. So what we see with Moderna and Pfizer is you have a 2-dose series initially. So the first dose is to build that first response. So you get some protection from COVID after the first dose. And then the second dose builds a second immune response. What that does is it increases your protection. So the first dose might have some protection, but then the second dose dramatically increases that protection. Because now your body's like, all right, I've seen it the first time. I saw it again now. So now it's very dangerous. And I'm going to build up antibodies against it. to prevent a third infection. And that's why we recommend, or that's why scientists recommend when you're dealing with Moderna and Pfizer, a 2-dose series. That's why they tell you to get the second dose 3 weeks after, or 3 to 4 weeks after. Yeah, so when we're talking about vaccines, who can get the COVID-19 vaccine?
Right. So kind of like what you were talking about earlier with the first dose as well as second dose for some case, some of the vaccines, as well as booster dose after. Most people, we do recommend to get the vaccine as soon as you can. I know in the beginning with like COVID in 2020, really kind of it was, even 2021, beginning of 2021, it was like a scale, a little time lapse of a little bit of like who is eligible to get it. So we started with 65 plus and stuff, and then finally eventually we opened up to everyone else.
And now it's everybody else.
Yes, now it's everyone. So please get the vaccine as soon as you can. But the only kind of like limitations is really if you are currently sick with COVID-19, please wait till after your quarantine period to or when you're not infected to get the vaccine.
Yeah.
And what else? If you have had coverage, please go get the vaccine.
Yeah.
And it's not, there's no penalty for not getting the vaccine. But it would be best for you as well as anyone that you know who who can be really impacted, negatively impacted by having the COVID, being exposed to COVID-19.
Yeah.
And you don't want to get sick yourself too. And it's better that you get vaccinated. And even like, it's not like it's impossible to get COVID-19. So even if you're vaccinated, you can still get it. But the chances of you being really sick or being hospitalized reduces by a lot.
Yeah. So, just to like clarify all of that, if you're worried about catching COVID and you're not vaccinated with your first dose, then please go get your first dose. Unless you're infected or you're currently sick with symptoms, wait for those to resolve and get your vaccine. If you're contemplating whether or not to get the booster dose, definitely get it if it's been at least 6 months since your last dose. And that includes people who already had COVID-19 infection. So what scientists are finding out now is that even having COVID-19 infection, you're still susceptible to getting COVID-19. I think a myth oftentimes is I already had COVID, so I can't get it again. You can still get it. Even with the vaccine, you can still get it, but the chances are reduced for you getting it. So if you're already recovered from COVID-19 infection and you get the vaccine, you're increasing your body's protection against COVID by that much more. So you still get it. And of course, like Mariam said, it's not required by law. It's not illegal to not get the vaccine, but you should in the name of public health and protecting your friends, your loved ones. Because if you're not vaccinated, that's just an easier way to spread the virus. That's one more way that the virus can get inside your body and get into your community spaces.
Yeah, and now most workplaces and school, I don't know about schools exactly, but definitely workplaces are required.
Definitely in the city, definitely New York City.
So.
The one caveat I will say is that if you are allergic to any of the ingredients in the vaccines, which you can find on the CDC website, they have a list of ingredients. For the mRNA vaccines, it's 4 or 5 ingredients. You can look up this information. If you're allergic to the ingredients or you're immunosuppressed, please speak to your doctor first before getting vaccinated. Most people are eligible to get the vaccine, but if you're having any doubts or you've had a vaccine in the past and you had a bad reaction to it, please speak with a healthcare provider before getting vaccinated, for sure. A question that comes up a lot from community members when we're doing outreach is, well, what about my immigration status? They'll be undocumented, or they'll let us know that they're undocumented, and they're kind of afraid of the federal government getting involved because of their immigration status. So the first thing that should be addressed is that all New Yorkers are eligible for COVID-19 vaccine, regardless of cost or ability to pay, I should say, and regardless of immigration status. So when you go get a vaccine, you don't have to provide any proof of citizenship, proof of residency, just some form of ID to recognize or corroborate your name. And there's, I think, something that asks about your date of birth and your address. But there's nothing that is particularly identifying that is necessary to provide. And all the information that you do provide is not shared with the federal government in any way or immigration authorities. So the information, the personal information you collect might be shared with the CDC, but not in any way with immigration authorities. And the last point that I want to address is that there is no public charge or immigration-related consequences to receiving the COVID-19 vaccine. So if you're afraid of that, if you're in the process of getting a residency or citizenship, there's no penalty for getting the vaccine. And the next point I think it's important to bring up is about vaccination myths. So we oftentimes hear from people misinformation that they've gotten or myths that they heard that's preventing them from getting vaccinated. So we wanted to address what are those myths that we've commonly heard.
And there's many, but we
Yeah.
just selected a couple, and
Yeah.
we've also already, Kenneth has addressed some already in the presentation.
Yeah.
So one of them is there's no point in getting vaccinated due to new COVID strains. So
Yeah.
there's new variants coming out all the time, Kenneth. So why should I get vaccinated?
Yeah, and the reason why this is a myth, and the reason why you should get vaccinated is because if we just go back a little bit to what we learned about how vaccines work. So with the COVID vaccine, it targets the spike protein in COVID. However, with the new variants, they're always evolving. So the efficacy, how strong, how potent these vaccines are, it decreases. However, the vaccines, for the most part, still work because the goal is not to stop you ever from getting COVID, because that's very difficult to accomplish. But the vaccines still have the effect of preventing you from getting COVID. So there's a decrease in possibility that you will get COVID-19 from exposure if you were exposed to COVID-19 and you're vaccinated. And most importantly, it still works in preventing people from being hospitalized due to COVID-19. So the biggest the biggest problem with COVID-19 is that it's unpredictable, and the consequences that you will have that you will experience if you are infected with COVID-19. We simply don't know if once you get infected, if it'll be a mild form, a moderate form, or severe form. And we have some factors that maybe we'll think about and we can consider when you're infected, if you have any other conditions like diabetes or cancer, what have you, but there's no way to tell. So with the vaccine, what that does is that it helps keep you out of the hospital. So there's still a point to get vaccinated. The COVID strains mutate and change the efficiency of these vaccines, but they don't make them completely, they don't mutate to the point where the vaccines now can't help you at all. They still help you.
Yeah, and that's kind of to talk about the side effects. Am I the booster shot? Is so important because of all of these mutations that are happening with the variants. If you get boosted, that just reinforces.
Yeah, exactly. So when you
fight against it.
And that's a great point to bring up, because the CDC recommends getting the booster to prevent Omicron infection, right? So we've all heard about the Omicron variant. Basically, they found through their studies, and studies that have been corroborated by other outside scientists, that getting the booster shot helps bring your body's immune response level or antibody levels back to where it was before, to the point where it effectively fights against Omicron. So when you have the 2 doses of COVID, say you get an mRNA vaccine and you have 2 doses, if you compare that to somebody who has 3 doses, with the third being the booster, the person with the booster has a much better chance of preventing Omicron infection and a better chance of fighting COVID-19. So even vaccinated and to get your booster.
And the other myth is that most people believe that pharmaceutical companies are the bad guys.
Yeah.
They're evil. We don't want nothing from them.
Yeah.
You can't trust them. So what is the truth behind that?
Yeah, so when we're talking about pharmaceutical companies, people tend to do one of 2 things. They lump them in with the government and say, they're all the same. So I distrust the government, I distrust pharmaceutical companies. Or they'll say pharmaceutical companies have a history of false steps, of mistakes, of errors in the past. How can I be so sure that this vaccine isn't going to be one of them? So to that, I'll say, 1, pharmaceutical companies work separately from the government. So if you have this distrust in government, which is completely a personal preference, if you have this distrust in government, pharmaceutical companies work outside of that, and they're also, the products that they have, well, the COVID-19 vaccine being the specific one we're talking about, has been supported by outside scientists all across the world and governments outside of the US. So distrusting the US government shouldn't necessarily disable you from trusting the opinion and advice of outside scientists and outside governments and their trust in the product, being the COVID-19 vaccine. The second point being that, yeah, the pharmaceutical industry and pharmaceutical companies in general have a history of errors and mistakes, and I'm sure we can all think of one, but that doesn't eliminate their all the other products that they put out that have successfully been vetted by the FDA and that we currently use on a daily basis. So, we are skeptical of COVID-19 vaccines, but we take ibuprofen and we take Tylenol, we take antibiotics and chemotherapy medicines, and those are all from pharmaceutical companies as well. So we have to understand that, the acceptability of the COVID-19 vaccines is not just based on the history of false steps by the pharmaceutical companies, but on if the science speaks for itself, if the science works, if the vaccines work. And the overall general consensus throughout the world and by many other governments is that it does work. And that's been proven time and time again.
And all in all, to say, should you get vaccinated? Yeah, if you haven't understood what we've been saying so far, yes, yes, and yes. Yeah. Please get vaccinated, because everyone wants this, season and this whole COVID-19 chaos to really just come to an end. Again, it doesn't prevent the COVID-19 vaccines from COVID-19 to just disappear, but it really does help, and especially with the variants being mutated even more and everything like that. So exposure to the elderly, children.
Clinical outcomes, better outcome in the hospital settings, than individuals who are unvaccinated and who are infected with COVID. It's just so much uncertainty when you're unvaccinated and you have COVID that we don't know if it will be a mild. Again, we don't know if it's going to be a mild case or a severe case. Whereas with the vaccine, it's more predictable, reliable to know how you'll fare. And at the very least, your chances of being hospitalized for your COVID-19 infection is reduced. Of course, again, just to reiterate, if you have any severe allergy to any ingredients of the vaccine, or you had a severe allergic reaction to previous vaccines, a flu vaccine or MMR or any other vaccine, and you're immunosuppressed or immunosuppressed, please speak to your healthcare provider or doctor before you decide to get vaccinated.
Yeah, and just a little reminder of what things to do whether you feel sick, just in general, COVID-19.
Yeah, even after you get vaccinated.
Even after you get vaccinated first if you haven't yet. Of course, get tested if you feel any type of symptoms. You're not feeling well, just get tested to just make sure that everything is okay. Keep washing your hands. Make sure your hands are clean at all times. Coming in from inside, you touch the surface that you're not too sure about, just wash your hands. Use hand sanitizer that's, I think, said at least 70% alcohol based. Stay home if you feel sick, and again, get tested. Keep physical distance, so make sure you're usually 6 feet away from your person next to you, especially if you feel sick, and continue to wear a mask. Just because you get vaccinated does not mean that you cannot get the COVID-19 virus.
And particularly about mask wearing, if you are wearing a surgical mask and it's just a single surgical mask, please wear that surgical mask in conjunction with a cloth mask or just double mask. It's coming out now that just having a single mask, a single surgical mask, or a single cloth mask is not enough. Doesn't offer as much protection as KN95 or N95 masks. So make sure you double mask when possible.
Yes, and inform your community. So this is one way we're getting in contact and even talking with our community for them to learn more information about what the COVID vaccine is, what COVID testing is, COVID-19 testing is, and everything. So one thing that we also do, one activity that we do is both partake in outreach. So the HRSA team as well as the T2 team, we partake in outreach. So that's our first and foremost way of reaching out to our community and informing our community. That's on our behalf.
And just a little bit more to that point that Mariam brought up. One way to get involved, and the most important way, in my opinion, to get involved is to share this information with your friends, your family, and anybody else in your social circles. So obviously the primary goal of these Empower Hours is to empower you with knowledge against COVID-19 vaccine misinformation, misinformation in general related to COVID-19. But then also so that you can pass this information on to your friends, family, and others in your social circles. That way it disseminates, and people who you know or you've heard talk and spread myths, you can make sure that message reaches them. And another way to another way to do your part in informing your community is to speak out against misinformation in your social circles. So if you hear a myth or you hear misinformation being spoken and spread, be sure to speak up and point it out and let them know that this is just a myth that's often spread, or this is misinformation that doesn't have any science behind it. One way to build confidence in doing that is to stay well informed, of course. You can keep staying well informed by expanding your media, making sure that the viewpoints that you take in, the information you take in, comes from multiple different sources, to check the source, to make sure that it's from a reputable news site or something that has some reputation and some credibility to it, that is not a blog post or something that doesn't have that reputation or validity. The third point, the third way to stay well informed is to be skeptical of the information that you take in. So don't just believe things just the first time that you see it. Not every Facebook post that talks about COVID-19 is a 100% certified fact. And that leads into the fourth and last way, which is to check incredible claims. If somebody's saying that COVID-19 virus is causing, or the COVID-19 vaccine is causing you to get COVID-19, then check that, just Google it. I think you can also speak to your healthcare provider about it. As long as you try to stay well-informed or as well-informed as possible, and you try to stay away from spreading disinformation while speaking out against it when you hear it, then we're doing a good job in making sure that our community stays well-informed. Yeah, and you can also join us in talking to the local community when we do our outreach.
Yes.
So I, as part of the HRSA team, we often go out into the community, which can be the local community or communities in Brooklyn, Staten Island, Queens, the Bronx, and Manhattan, all 5 boroughs. And we talk to local community members to get a kind of handle of what they think about the COVID-19 vaccine, see if there's any misinformation we can help break down, and provide them the resources that we offer to get vaccinated if they want to get vaccinated, or to have that discussion about the COVID-19 vaccine in hopes that they'll feel comfortable and confident in the future to get vaccinated. And I know Mariam works with the T2 program.
Yeah, with the test and trace. So basically it's kind of a similar, but different, where originally like test and trace, it was really the testing to really focus on testing, getting tested for COVID and making sure everything is okay and following up. And then with the vaccine, after the vaccine came out, really encouraging people to get the vaccine as well. So we mainly distribute PPE, masks and sometimes hand sanitizers, depending on our availability, and on events as well. We also give out children's masks, which is really rare to find, surprisingly. And I didn't realize that till we started distributing it. And people are like, wait, there's children's masks. And you'll be surprised how many people still don't like take it, but then there's so many people that actually really need it and that just don't have access to it.
Yeah.
So that alongside just some information about like what the vaccine is and why you should get vaccinated, why you should get tested, and just keeping up with like getting tested, staying home, the visual.
Yeah, and you can always, like we have on the slide right now, you can always contact us and volunteer to help us, whether that be helping to distribute PPE to the local community or joining our community outreaches to talk to the local community. We're always welcoming of volunteers and community members who want to help out. So please do, it would be great to see you. And here's just some information about the COVID-19 helpline. So if you have any concerns or questions or lingering issues in your mind, you can always contact the COVID-19 helpline in English and French at the first number. And if you have any questions or concerns that are in Spanish, if you're a Spanish speaker, or somebody you know has questions or concerns and they speak only Spanish, feel free to contact the number on the second line listed for Spanish. You can also leave a voicemail or send a text at any time, and we'll try to get back to you your question as soon as possible. I'm also providing the HRSA team email. So if you have a question or comment or issue you want to email us about, we prefer to use email instead. There's our email, so you can contact us.
What does HRSA stand for?
Yeah, that's a great question. So basically what HRSA is, it's the Human Resources and Service Administration. We just work in tandem with the federal government. So the Human Resources and Services Administration is a department from the federal government, and they are basically helping us do our work. Where we're a team that's created from their efforts. Yeah. And here's some more information about how to contact us, for our addresses, where we're located. You can also follow us on social media. We have pretty frequent postings about COVID-19 information, vaccine information, misinformation, and they're in English, French, and Spanish as well. You can find us on Instagram, Facebook, Twitter, LinkedIn.
And feel free, if you want to get directions to African Services Committee, you can call, and there's usually an option to get direction, but if anything, the receptionist can also help you out.
Yeah. And here are some references. Of course, this slide is important when we are thinking about checking your sources. So what we just talked about, any information here that you've seen regarding vaccine science or how COVID-19 vaccines work, you can, if you're dubious about them, if you're skeptical, that's great. You can always check the information by checking these references and reading information yourself, straight from the source.
And CDC is also one of them that we
Yes.
I think.
Yes. So yeah, so you can always go to the CDC website and read the information there. That's constantly updated, and that's a great source of that's a great, a reliable, credible source of information that you can read from. So please feel free to check our sources and get the information yourself. And so now we're going to take the time to answer any questions that maybe have been answered by you guys, or maybe that be through Facebook or Zoom or what have you, whatever platform you're on. And we'll just take the time to ask some questions. Also some questions that we've often heard from the community during our community outreach. We'll take the time to answer those as well, just to kind of give you guys some more information. And please feel free to call or text the helpline at the numbers below on the slides.
So it doesn't seem like we have any questions right now, but of course we have questions ourselves that, like, kind of said, like, we've gotten from the community, and so that we've been out there for a few months. I feel like one of the conversations is about, like, the children, the vaccines for children, and like kind of why should children get vaccinated?
Yeah, I've heard that often a lot as well in our community outreach. So people will often say, well, the COVID-19 virus doesn't affect children as much. They're not really a concern when it comes to the most severe form of COVID-19. And we don't worry about COVID-19 killing them, so why should children get vaccinated? So the answer to that is twofold. So the first answer is that even if COVID-19 doesn't affect or manifest or create a severe form of sickness in children, that doesn't mean that they can't spread it themselves. So if you're in a household and say you have somebody who's immunocompromised or has these other conditions like diabetes or cancer or heart conditions that statistically make them more likely to have a very severe form of COVID should they get infected, the child in that household, if they're infected with COVID, can still spread it to that person. So even if that person is being super cautious, super safe, washing their hands, wearing double masks, if that child is unvaccinated, they're at greater risk of contracting COVID and then spreading it to that person. So that's something that we want to prevent. The second thing is that there have been often reports, and you can go to the CDC website and read this as well, but reports of severe forms of COVID in children as well. So it's not as if all children are exempt from severe COVID-19 clinical consequences. Children have been affected as well by severe forms of COVID-19 symptoms. And to protect against that, just to prevent that, you can get vaccinated. There's no trade-off, there's no cost-benefit analysis that has to be done. Children who get vaccinated, which will often come in the form of the Pfizer vaccine, are better protected against COVID, and the risks and potential rare adverse effects from the COVID-19 vaccine for children far outweighs by any means COVID-19 infection in children. So the science is in, you can again read it in the CDC website, but the science is in, and children are better protected against COVID, and the outcomes are better for them should they get vaccinated. Yeah, and that actually brings up a question that I've heard often from community members as well. It kind of relates to that is, if I'm pregnant, should I get vaccinated? Yes, the answer is yes. Again, like the science from the CDC, information from the CDC tells us that women who are pregnant have a greater chance of miscarriage if they are unvaccinated. And I think the concern comes from, the concern behind that myth comes from, oh, what if I get vaccinated and it affects my pregnancy somehow?
Right. Yeah.
But the question should be then, with this information from the CDC, if I'm unvaccinated, will COVID-19 affect my baby? And the answer says yes. It'll affect your pregnancy more, or could affect your pregnancy more than how the vaccine affects you during your pregnancy. Again, the benefits and the potential rare risks far outweigh COVID-19 infection in that regard.
Yeah. And actually getting vaccinated today, and the DOH meeting I was in, they were talking about how a pregnant woman getting the vaccine actually does build immunity for the baby.
Oh, which is great.
So,
yeah.
So most people don't know that still, and it's like, yes, so pregnant women should definitely get vaccinated.
Yeah.
So simple yes.
Yes. Yes.
Please do. Yeah.
And kind of like going up towards the legal immigration aspect of that. We often hear in the community, well, what about my immigration status? How would that affect me? How would getting the vaccine affect me, and possible deportation or consequences relating to immigration status? And as we said previously, there is no immigration consequences for people who are undocumented to get the vaccine. It is confidential, free, and there is no association with the information that you do provide with immigration authorities whatsoever.
And we emphasize that because most of the African services community clients are either undocumented or refugees. So,
yeah, or they're in the process of getting their residency or citizenship. Yeah.
So, yes, very important. So yes, don't worry about that. Please do get vaccinated. Yeah. And
yeah,
I don't think we still have any.
I think so. Oh, well, the one question that I often hear, and I mean, we've learned that through the vaccine science slides, we learned that it is not possible, is, well, what if the vaccine changes my DNA?
Oh, yes.
Yeah, and we've talked about how, when we're talking about mRNA, which is in the mRNA vaccines, and it's in the virus in the Johnson vaccines, which is a viral vector vaccine. When we're talking about them, the mRNA can only be turned into protein, but the mRNA doesn't have a way in your body to be turned into DNA. There's no protein or enzyme in your body naturally that will turn that mRNA that's introduced in a vaccine into DNA. So there's no change possible to your genetic code. It's not going to affect you in any way with your genome or your genetic code. So there's no concern for that. And often people are concerned of how long the mRNA stays in your body. They talk about, well, what if you don't show signs of any bad reactions or bad effects now, but in 3 years or 5 years in the long term, maybe it'll affect you differently. And the reason why scientists are not particularly concerned about that is because the mRNA fragment, the little piece of the COVID-19's genetic code, that's broken down soon after vaccination. So there's nowhere for it to go. It's degraded by your body. It just vanishes. So there's not a concern there for long-term effects. And if there was any issues that we would have anticipated in the long term, the chance of it popping up by now is great. So we haven't seen anything like that. Scientists haven't seen anything like that. Even in the clinical trials, the science behind that there's no science to support that. So the outcome is still, you should get vaccinated.
And also, like, in relation to that too, we don't know the long-term complications of having COVID-19.
That's true.
Without being vaccinated.
That's true.
So we see the results of people who haven't gotten vaccinated and had higher hospitalization rates and everything. So which is another reason why we keep encouraging the vaccine, of getting the vaccine. So especially with children, like we don't know what the long-term complications might be.
Yeah.
So we want everyone to be vaccinated.
Yeah, and there are already cases of long COVID-19. So those people are referred to as long haulers, people who suffered either adverse conditions as a result of having COVID-19 infection, or they're still having issues, or they're still being symptomatic of COVID-19 even months after infection. People who are in that category, people who are they can't smell, they have something called anosmia, so it affects your sense of smell and your sense of taste. That's a recorded thing that's been documented, but there's nothing of the sort that we can see in a significant way with the COVID-19 vaccine. And again, you can always check down the CDC, always do your research to check it up and verify the information. But the message is still the same. It comes out clear that you're at greater risk for any potential adverse reactions in the future if you're unvaccinated and you catch COVID, than if you're vaccinated and you're protecting yourself from getting COVID-19.
I feel like one of the other things that was being talked about a lot in communities was the microchip.
Oh, yeah.
We just went over this of like what the vaccine actually is, especially the COVID-19 vaccine. So
so please go to the CDC website. A lot of people think that these pharmaceutical companies are hiding their ingredients, but they're freely available. You can, it's pretty short because the list of ingredients is pretty small. It's about 4 or 5 ingredients. So go to the CDC website and search vaccine ingredients. You'll find them there. They basically consist of fat because they have to make a fat bubble to introduce the mRNA to enter your body. That's just how it works, the mRNA technology. Fat, sugar is used to stop it from being degraded immediately, being attacked by your body. Salt, I believe, and mRNA, and there's something else, but 4 or 5 ingredients, and you can search up the ingredient list on the CDC. Yeah,
and I think really to almost wrap it up, if you want to find a vaccine site where you can get vaccinated, if you're not sure, especially in terms of communication, language barrier, feel free to reach out to us, PERSA team, me, on the helplines, numbers that are provided, and we can help you do that. As well as if you are already tech savvy yourself and just want the website, vaccinefinder.nyc.gov. Vaccinefinder.nyc.gov is the perfect website. You just enter a zip code that's convenient to you, most likely where you live. And it will pop up all the information of like the hours that the place is open, what vaccines are available, if boosters are available. If this will be your first time getting the COVID-19 vaccine, it will tell you if you can get the $100 incentive. And now boosters.
So a point on that is, if you're interested in getting vaccinated or even the booster, until the end of the month, so February 28th, until the end of the month, there will be $100 incentive for any person who wishes to get the booster dose. So that incentive still stands for people who are getting the first dose. But if you're interested in getting the booster dose, there's a $100 incentive until the end of the month. And at our vaccine event, which is
next Monday, February 28th.
We will
4:30 to 4:30 p.m.
We will be working with Ryan Health to provide those incentives on behalf of Ryan Health. So you can come here, get your vaccine, and then Ryan Health will help you get the incentive as well. So there's never been a better time to get the booster. But please follow us for follow-up COVID-19 Empower Hours. We're having them on a monthly basis. So the next one in English is going to be on March 21st. We're going to have a doctor there to talk a little bit about what his experience is with COVID-19 and the community, and talking to the community about COVID-19. We'll also have a session in French on March 23rd and a session in Spanish on March 25th from 12 to 1 p.m. Eastern Standard Time. And you can always follow along or see the recorded session on our social media. So follow us at African Services. Well, thank you so much, and hopefully we'll see you at our next section.
Thank you.